This video is all about the Kirby Bauer test, and this test looks at antibiotic sensitivity. So remember, we take antibiotics to control microbial growth because the antibiotics are either going to kill the organism or prevent it from replicating. So with this test, we are looking to determine if an organism is susceptible to an antibiotic, meaning the antibiotic works. It prohibits bacterial growth, or is the organism resistant to an antibiotic, meaning the antibiotic has no effect on that pathogen. So if an organism is resistant to the antibiotic, there's no point in giving that antibiotic to your patient because it's not going to do anything. It doesn't phase the bacteria. So how we use Kirby Bauer in the lab is more for identifying an unknown organism. Okay, so it's a little bit misleading. So what I first want to talk to you about is what we actually use Kirby Bauer for out in the real world. So if you go into a healthcare profession and you are told to do the Kirby Bauer test or analyze the results of it, I want to make sure you know what's going on. Okay, so oftentimes you will have a patient and maybe you know the patient has a Staphylococcus aureus infection, but this organism is resistant to a lot of things. So you need to figure out what are your options for treatment. So what you would do is you would collect a sample from your patient and you would swab that bacteria on an agar plate. You would completely cover the plate. And so this is called making a lawn, L-A-W-N, making a lawn of bacteria because you're completely covering the agar plate with bacteria. Now, before you put the plate into the incubator, okay, you would add these different little white discs, and each disc has been soaked in a different antibiotic. So on this one plate, you may have one organism, Staphylococcus aureus, but maybe one disc has been soaked in chloramphenicol. One disc has been soaked in tetracycline. One disc has been soaked in, I just completely went blank, antibiotic B. Sorry, y'all. But the point is, each of these discs would be soaked in something different, okay? So once you've added these discs, you would put the plate in the incubator. Then the next morning, you could come back and you would see something like this left-hand picture. Notice the disc right here, where my mouse is hovering around. Notice how the bacteria grew all up around that disc. That means the antibiotic had no effect on that bacteria. The bacteria grew just fine. So we would say that the organism is resistant to that antibiotic because it grew perfectly fine. So you would not want to give your patient whatever drug had, been on this disc because it won't be effective. However, if you look at this other disc to the left of that one, notice there's this clear zone. This is called the zone of inhibition. This is where growth was inhibited due to the antibiotic. So we can say that the organism is likely susceptible or sensitive to this drug. Now, it is a little bit more complicated than this. There's actually you'd have to measure the width of this zone of inhibition and look at a chart to accurately say that the drug is susceptible or not. Or I'm sorry, that the organism is susceptible or not to that drug. But for this video and for the purpose of our lab, you're strictly looking for the presence or absence of a zone of inhibition, okay? So for our purposes, we can say that the drug here that has this really nice big zone of inhibition is a good treatment option for your patient, okay, because the organism is susceptible to that drug. All right, so to kind of recap, in the real world setting, you would have an idea what your organism is, and you'd be trying to find which treatment options are the best. Now, it is possible that you may not know what your patient has, but you may still need a way to treat it, right? And so you want to get that bacterial growth under control. So you could, take a swab from your patient and completely cover this plate with that bacteria. Again, that's called a lawn. And you could still do this same technique and put multiple different drugs on there so that while you're figuring out what your patient has, you can at least be starting a treatment. Okay? So again, one organism, lots of different drugs. So you can have an idea of what treatment options are. So what are we doing in this lab? Well, for this lab, you would be using the Kirby Bauer test to differentiate between some of the Streptococcus organisms, okay? So for what we are doing, you would take this blood agar plate that you see right here, and on the top half of the plate, you would create a lawn of one of the organisms, and then you would throw out that cotton swab. You'd get a different cotton swab and cover it with a broth from organism B, and you would completely cover the bottom half of the plate. Okay, so again, two different organisms on this plate. Then you would get an antibiotic disc and put it in the middle of the top section and in the middle of the bottom section. So these two discs that you see on this picture have been soaked in the same antibiotic, okay? So two organisms, same antibiotic, because as you'll see on the next slide, when we're looking at our unknown organisms, one of them is going to be resistant and one of them is going to be susceptible. And so that's what you're trying to see. Which of the two is resistant and which of the two is susceptible, okay? So again, in lab, we're using this technique a little differently for our purposes. But again, y'all, your observation is going to be the presence of a zone of inhibition or the absence of a zone of inhibition. Because remember, the observation is what you can physically see, okay? You can physically see this zone of inhibition. You can physically see that organism A, there is no zone of inhibition. Now, the results you record are either susceptible or resistant. It is susceptible if there is a zone of inhibition, and it is resistant if there is not a zone of inhibition. So let's take a look. If you think back to the blood agar plate discussion we had, we'd said that you can divide streptococci into three groups based on their ability to break down red blood cells. And so one way we can categorize our streptococci is being beta hemolytic. They had those clear halos when streaked on a blood agar plate. Well, when it comes to our unknowns, we had two organisms that were beta hemolytic, Streptococcus agalactiae and Streptococcus pyogenes. So for the purpose of our unknown flowchart, we need a way to differentiate these two organisms. And the way we do that is by doing the Kirby Bauer test using an antibiotic disc soaked in bacitracin. And you'll notice that Streptococcus pyogenes is susceptible to bacitracin, whereas Streptococcus agalactiae is resistant. Similarly, if we think back to our alpha hemolytic streptococci, we had two, and so we need a way to further differentiate them, right, for our flowchart. And how you do that is with the Kirby Bauer test using a disc soaked in optoshin. And you'll notice Streptococcus pneumoniae is susceptible and Streptococcus sanguinis is resistant. All right, y'all, that is the end of this video. Please let me know if you have any questions.